much for Apurva for coordinating the session. And yeah, like I already know of Ravi Chukula and Varun who joined this call today because they are one of the startups from our cohort programs. And yeah, like if the participants can give a quick introduction to Visu Garu and Hema Mohan Garu, that would be great.
Yeah, this is Ravi here from Heart Health Technologies. Visu Garu, this is we are into AI-driven cardiovascular clinical decision support systems to improve the screening, diagnosis, prognosis, and management of cardiovascular disease. The tool essentially makes the cardiologists and cardiovascular radiologists accurate, fast, and consistent in their reporting. That's the basic application in the workflow. The idea is that when applied across the care continuum, it can dramatically change patient outcomes, as has been observed. And now, for the last 3 years, during and post-COVID, the focus has been extensively on a multimodal cardiovascular imaging, and we started before COVID. So we are actually in the sweet spot right now with a good tailwind.
Thank you, Ravi.
Yeah, thanks. Thank you.
Varun from Symbionic. Varun, I think you're on mute.
Yeah, can you hear me?
Yes.
So, hi, I'm Varun, and my colleague Samta has also joined the call. So, we are from Symbionic Tech. So, we develop upper limb bionic prosthetic arm. And we are currently in MVP stage, and we are just starting out with lab testing.
Sorry, Varun, your voice is breaking.
Yeah, actually, I had some problem with my mic. I guess some
Varun,
will tell you more about the product.
Yeah, Varun, Sampriya, you are from the VAT?
Yes, we are from VAT. I believe we also had a call with Dr. Hema regarding the patents and clinical things.
Yes, Varun. Yeah, we had a call.
Rishi is our CEO. He's currently in Bangalore. He's on his way to Bangalore. So he's having some meetings. So we had to join those session.
Perfectly fine. Like,
Sure.
and
I
Pallavi?
think, yeah. Pallavi Garu, we just started with the quick round of introductions. So if you could unmute and speak about your startup, that would.
Yeah, good afternoon. I'm Dr. Vimla. I'm advisor for the Sanjiva Homeopathy. Pallavi is my daughter. Ours is a small homeopathy clinics where I have find out a problem and a solution for it. That is hypothyroid or thyroid disorders. I have a solution which I have done in software where the diagnosis or a protocol which we follow will come in it. So any doctor who can use that one can use that and give treatment for the thyroid problem.
so ma'am, if I understood, you are developing a diagnostic solution.
Not complete diagnostic solution, but mine is a pathological way of treating patients.
It's a treatment. Okay.
Yeah, treatment, protocol of treatment, homeo treatment.
Just for your information, ma'am, like general clinical treatment protocols, so they cannot be IP'd. So wherever there is a less chance of intellectual property and there is no barrier which anybody can do, usually DAG team would like to know how you will have an advantage, because these are open, right? So we can't patent these kind of things. but we will discuss maybe more detail, after talking to all people.
Yeah, done. Okay.
Yeah, Ram Prasad Garu, Dr. Ram Prasad, who have joined us. Okay, let's have Aniket. Aniket, we just started with a quick round of introductions. In case if you want to introduce about your startup, please feel free.
Yeah, so my name is Aniket. I am co-founder of Avinya Neurotech. We recently incorporated our startup, and we have started our journey from Center for Healthcare Entrepreneurship, IIT Hyderabad. We are working in the area of detecting neurological disorders like non-convulsive status epilepticus, which is a very serious problem in ICU and emergency department. So that's where we are trying to come in. Thank you.
Thank you, Aniket.
Krishna Lata, if you have joined. We are doing a quick round of intro about the startups. So in case if you want to introduce about your startup, Krishna Lata, who joined. Okay, sir, over to you.
Okay, since most of you are familiar with the grant programs, so today we will not be detailed grant introduction, but maybe what we will do is very quick introduction about maybe 1 or 2 case studies, or maybe over 15 minutes to 20 minutes, me and Hema, and then maybe discuss with each one of you on what kind of help you need. So it's about ask BAZ, but you can ask about anything, and when you are applying for the next thing. So we will keep it open for the next half an hour. Is that okay with everyone?
Yes, sir.
Great. And as I mentioned, it's a very informal thing, so you don't have to wait for the presentation to complete. Just stop me wherever you think something is not clear. We will take it from there and spend time on the particular slide. So I'm Visu. I'm a scientist by training. After PhD at IISc in biochemistry department, I went to a postdoc in a Marie Curie Industrial Network program. Worked with interleukin 4s, and then moved to UK. Worked in a cancer hospital. Working with the CRISPR-Cas models to create in the lab how DNA protein interactions exist in patient samples who don't respond to the standard cancer therapies. So this is a brief introduction about me before coming to grants program. At IKP, I manage innovation grants, including BIZ, and also lead the Life Science Incubator. We have over 390 researchers who received support across various programs of IKP. We'll be very happy to help you in any manner we can. Today, with me, my colleague, Dr. Hema is also there. She works at IKP Technology Transfer Office. And maybe, at a later point when she is speaking, I will request her to introduce herself. So broadly, these are the things what we do at IKP. IKP is a non-profit organization. We are a science park situated in the Genome Valley, Hyderabad, starting from mentoring, funding, infrastructure support to incubatees and virtual incubation support, and also support for large companies. And through our technology transfer office, we also provide IP, legal, commercialization support. And through various programs, we also enable networking and peer learning for the researchers in our network or anywhere in India for that matter. And now even the postdocs abroad, they start talking with us in very advance, how to relocate to India, how to start applying for this. So basically, any scientist want to take their research, a clinician, engineer want to take their ideas into a product form and to the market. So we'll be very happy to talk with them. So these are some of the numbers put there. So we have total 1,375 researchers, small companies, large companies who received a funding support of around 350 crores, and they were able to raise 3,500 crore plus. So in that way, we enable the researchers or the startup companies to go to the next level, Of course, most of you are familiar with the IKP grant programs, but Science Park is the major thing through which we are able to enable these things. We have more than 4 lakh square feet facility for helping for scale up, establishing R&Ds, plants. So we'll be very happy to talk these things offline. So I will not be going into details. Since some of you are mature, so I will just say, in case if you will be having multiple projects, right? So if a project is at a mature stage, you can apply for this seed and leap fund. Seed is an early stage support program. This is up to 30 lakh rupees as equity investment and up to 1 crore rupees for the advanced stage solutions. These are from BIRAC, and IKP Knowledge Park and IKP Eden are the funding partners. So similarly, there are several other partners. So you just keep looking for the call announcements. Along with this, IKP also has a digital health entrepreneurship program where funding support is enabled and mentoring connected with the hospitals and clinics. During COVID time, we had a special fund called ICO Fund in partnership with BIRAC and various agencies. We were able to help bridge gaps so that the companies were able to complete their things and go to the next level. Okay, so just in case if somebody is interested and be it in your company or institute are looking for opportunities and thinking about starting a company, but they may not be having full knowledge and want to just understand more, Sparsh program is one very good initiative by BIRAC, wherein you will have an opportunity to work in these 6 fields: maternity and child health, aging and health, food and nutrition, waste to wealth, combating environmental pollution, agri-tech solutions. And IKP is doing on two of these topics, that is maternal and child health and food and nutrition. So in this program, the students, graduates who are selected will receive a 50,000 per month stipend for 18 months and also a small kickstart grant of 5 lakh rupees to test their ideas. And the teams are very diverse, and people who are selected starting from engineers to doctors to biologists. So they work together and form the companies, and we'll be very happy to talk to you if somebody is interested in these programs. They come twice a year almost, and there are 14 Sparsh centers across India, IKP being one of them. So in this, the advantage about the Sparsh program is there is an actual immersion phase in the early part of the program, and you will be taken to the actual site, where, for example, in case of MCH, Mother and Child Care, you will be taken to the rural hospitals and hospitals like Nilofer, where you can interact with the doctors and understand the problem at the site. And later on, you will start working with the experts, mentors in refining your problem statement and trying to come up with a solution with that Kickstart grant which I mentioned. And yeah, so since I thought I'll be talking with the diverse teams. So if you're developing sensors and working on AMR, this is a opportunity from BITS BioCity. This is a center of excellence at BITS Goa, but this is open to all people across India. So be it if you're working on agriculture, fisheries, aquaculture, AMR. So please visit the program page, and feel free to email chief manager at biocity.co.in. They'll be very happy to help you with these things. So the mini smart is for the early stage ideas that are at, up to TRL 3, and smart bio program is for the companies that are at a TRL level 7. But it's slightly mature. Okay, today it's about BAZ. Since BAZ call is going to be closed in 5 days, just so it's a 50 lakh rupees support for idea to POC, and it covers diverse areas starting from agriculture, environment, health, diagnostics, drugs, clean energy. Though the name is Biotechnology Ignition Grant, I think anything that serves the life sciences and touches lives, they are eligible, and we have excellent engineering teams who have done exceptionally well. So feel free to just ask in case if you are thinking that you have a solution, whether it fits or not. We'll be happy to connect with a similar team, because just now Dr. Ravi was mentioning about a solution for cardiologists and radiologists. So when it comes to the AAML solutions, the expectations, because in other cases they can produce tangible results and show the graphs, so show the results, gels, all those things. But when it comes to the digital solutions, they need to present their value proposition and what they have worked in a slightly more concrete form. Yeah. So with this, I will just take a pause and say that when you are writing a proposal, these are the 5 parameters usually evaluated most of the innovation grants. So is there an unmet need, whether somebody in the market is interested, if somebody is using your product, what is the value proposition, and project per se, is it technically feasible, so you can support with your own data or the data from the literature. And of course, most important thing for any project completion is the team, whether the team has strength. For example, most of the clinical related thing, they would expect you to have a clinician on board. If it is a hardcore engineering solution, they would expect the expertise with the core team. And as any other program, they would like to know the commercial sustainability of the company. So it's important to focus on all these 5 points. And BAG being innovation support program, they would look at what is the novelty and how you are going, if it is an incremental innovation, how you are going to add value to the existing things. So some of you might have written various programs, projects for different programs. Just I put some of those things based on the side headings of the BAG program. So I will not be spending time on this one, but maybe one-on-one discussion, you can decide to spend time on many of these things, be it title, introduction, team, objective, milestones, IP strategy, budget, value addition, and differentiation. So in the end of the our proposal reading, the reviewer should feel what you are going to do with 50 lakh rupees in 18 months time, and what are the 2 or 3 things that you will achieve. If you can bring out these points clearly, I think at least you have a good chance of going to the next round or in the final round. Yeah, so just for clarity, we took an example, since all the projects in BAG, the partner signs in NDA with the BIRAC, so we can't share the actual proposals, but we just made close to 1 or 2 real proposals where the titles are very long. So for example, the top one in the green, in the red, is actually one of the title, which I will not read full, but as you can see, it's almost like a paragraph, and this is the first point of contact with the reviewer. Reviewers will be receiving the titles and they will be asked whether you have any conflict of interest with these kind of things. Would you like to review or not? This is what they get. So you can imagine the top 3-4 red lines versus the green, 1 line in green. So wearable device for real-time monitoring vitals. At least the reviewers has clarity on what they are going to, we are not keeping in suspense. Yeah, just for fun. So when I was at a North Indian university, they were struggling with different parts of my name. So actually, I also made my name as Visu. So it's easy for everyone. Similarly, for the reviewers, it's important we present what we are going to do, and it actually they anticipate what is coming, and we can take it from there. So with this, I will hand over to my colleague, Dr. Hema.
Hi, good afternoon, everyone. So I am Hema, and I work at IKP, and within IKP, specifically at IKP Prime, which is the technology transfer arm of IKP. So at the technology transfer office, like I work with the innovators like you, be it from academia or from a startup, and help them identify what intellectual assets they have generated in their project, and then how we can commercialize them and how we can license them, take it to the market. So that's where I come and help the innovators. So I am by training a neuroimmunologist. So did my PhD postdoc from Max Planck Institute for Neurobiology. And I've been in the field of neurobiology for almost 12 years. Did 2 more postdocs, another one in Germany and one in UK. And after that, came back to India, where I was working in science management. And now I work at the tech transfer office. So, Vishu, next slide, please. Yeah, so in continuation to what Vishu had already talked about BIG and how you should look at the proposals and what are the important aspects. So another important aspect is the budget allocation, like so the 50 lakhs which you are asking for. So how you should like break down your budget. So there are different subheads in the budget, and each of the subheads carries a maximum of 30%, like so you can ask maximum of 15 lakhs for each subhead. And the reviewers would like when you say, like, for example, in your consumables and instrumentation subhead, so they would like if you are able to specify what exactly you're going to spend that 15 lakhs or 10 lakhs, whatever you have proposed, and how you are going to utilize it, what kind of instruments or what kind of consumables you are going to buy. And for example, if suppose someone is making a diagnostic kit, so for them they would be requiring different kinds of reagents. And for one similar reagent, for example, like you have a reagent like exonuclease, so you can buy it an Indian made, and you can also buy it from Merck. So the Merck one is almost 20-30 times expensive than the Indian made. So if you say that, okay, Merck is available, but I want to specifically go with the Indian made, it has the same specific activity and all, they would appreciate your, the in-depth the analysis which you have done, because then it will also show to them that you're good at what you are doing and you have done your homework clearly and you know what to buy and from where to buy. And coming down to the proposal per se, it would be good to write the proposal in a way, like suppose you should think yourself as a reviewer. And if you are a reviewer, then what all you would want applicant to write. So similarly, in that way, you should draft your application so that you highlight your major points over there, what you want to say, what is your differentiating factor, and how you are better than the others. Another important aspect of your proposal would be IP strategy. So here at the Technology Transfer Office, like, we help in formulating a strategy for you. For example, this is a slide where like two agricultural students during their master thesis, they were doing an experiment, like they wanted to make insect biopesticide. Okay, so in their experiment, what they did was they fractionated the cucumber, and the different fractions they kept near the window. And when they came back the next day, they saw that in one of the fraction had collected several of the insects in them. And then they thought that it might be possible that this fraction has something which attracts this insect. And then they came to us and then they said, we want to apply for BIG. And because they think that this fraction has some chemicals which is able to attract the insects, and these chemicals are called pheromones, to be very specific. And then we told them that they should at least try doing an experiment to support their hypothesis, because BIG, as Vishu has mentioned, these days it has become a lot competitive. It's not like in few years back where only just ideas were also supported by the grant. So since they didn't have much of the infrastructure, and also they just dipped the filter paper in that specific fraction which attracted the insect and put it in the field. And then after a few hours, they saw that the insect is sticking to this filter paper. So now when you go, now we cannot sell this as a filter paper dipped in some solution in the market, right? We need to make it into a nice packed product to be able to sell it into the market. So when they came to us, the IKP Prime team sat with them and they helped them formulate like how or in what way they can sell their product out into the market. So then we came up with this specific structure, and IP assets are the assets which you can build on. So IP is not just the patent, there are several other forms of IP. And the more the IP, the different kinds of IP you have with you, the better valuation you have for your company. And the investors are also like very much interested in the companies which have several different IPs, because then they understand that the founders or the people who are running the startup, they have they know what asset or the what benefits the IP can give a startup. So for example, here we came up with the patent for the formulation. You can also have patent for the way the release mechanism is, like how this specific formulation is being released out of this bulb. And then you can have an industrial design for the specific shape of this whole structure, and copyright for the user guide, and trademark for the name of the company as well as for the name of the product. So we don't say that you have to start working on all of them like at the same point, but from the beginning you have to think what are the different kinds, like how you can protect your product or the technology in different ways. So these are all the different ways you are protecting your intellectual assets. Next slide, please. So just to describe like why these kids, these agricultural kids from the agriculture college, like they got this BIG. So the first thing is like you need to choose a problem statement which solve some specific problem. Your problem statement need not be very fancy. It can be even like in the subsequent slides, I will show you a very simple problem statement can also be funded. So for example, here they showed that because of the fruit flies, lots of vegetables and fruits get wasted. So for them, they wanted to help the farmers increase their income as well as save the food product which is being generated or which is being grown in the farm. So that was a clear, like they were very clear with their problem statement and they knew how and what they are going to do. So for that, for the support of their problem, they did a pilot scale experiment with the farmers near them agriculture college, and these and here you can see like that the third picture is of that filter paper dipped in that specific fraction. So they went and put several of these filter paper across the field and did a mini trial even before they applied for BIG, and showed that their solution works, and they need money to scale it up and to bring it out in a product form. Next slide, please. So this slide tells you the impact what they have created, because in the end what the reviewers are looking for is your problem solving a is your solution solving a problem, and what is the impact it is creating. So here you can see that they are able to give farmer an additional income, and also they are saving the wastage of the food items over here. Yeah, next slide, please. So this is like during your IP strategy, in your IP strategy slide, you would have to tell like what are the different forms of IPs you would be generating, or what kind of IPs would be there in your product and technology. So this is just to show that like when people come to us with a simple solution, then we help them progress to better representation of their solution. So this was the example which I was talking, like where the problem statement is very, very simple. So this is again like a couple from a remote village in near Guntur. So they come from a farming background. So in the banana farms, like after you pluck the bananas, like the stump, like the farmers have to pay the laborers to cut down the stump and take the stump, the stem of the banana plant away and throw it them and burn it. So what they came up was like, since the stem is full of fibers, so they thought why not make fibers from it, and these are biodegradable, and convert them fibers and make like in this case like a shaving brush. They have also come out with a toothbrush and other accessories, other toiletries. So here so here the problem is very, very simple, but they have a huge impact. So it's a biodegradable one, and during COVID time they really gained traction because they were able to tie up with elite hospitality centers where because this is a use and throw brushes and toothbrushes. So and this also saves the planet because you're not throwing out plastic out into the waste, which is not degradable. So from this, what I mean, another important point for them was like they were able to employ the women from their village to build this product. So they are even in turn giving employment. So that was another impact which they were creating. So so we need to present ourselves in a very good way. We should not be very narrow and say, okay, we are solving only one problem. We should think little broad and say, okay, we are solving like one problem, we are decreasing the plastic load, we are making a biodegradable solution. In turn, we are also providing employment to the women. So, and thereby empowering them, right? So that we should be little broad in judging what all impact we can make. Next slide. So this is about another one. This is star for us. So this is Dozy. So this company is also formed by students, students from mechanical engineering from IIT Bombay. So they started this company around in 2015. So that time they came up with a solution for monitoring sleep and stress. And with this, they were able to tell problems in the heart. So they were able to point out if there is any heart attack or arrhythmia going to happen. And the reason for them to develop this solution was this was mainly developed for the older people. So like, for example, like we all stay far away from our parents and we don't know about their health conditions. So this was to support we could be very near to our parents by monitoring them day in and day out. So this is like a very thin mattress. It's like few centimeter thick and you can put it just below your mattress. And it's a contactless sleep monitoring system. And during COVID, what they did was they just pivoted. Because since already they were able to capture few of the vitals, they added few more vital measurement things to their device and started converting the normal beds in the hospital into the ICU beds, because the ICU beds are pretty expensive. They run into lakhs, and when you have to buy like hundreds of it runs into crores. So this device is just a few thousands, like 15 to 20,000. So in 20,000, just in 20,000, you can convert a normal bed into an ICU bed. And it was very helpful during COVID, because in that case, and they also digitized it. So for example, in a ward, if you have like say 20 beds, they could connect all these 20 beds to the bigger screen, and then in the screen all the vitals of all the patients will be reflected, and the ones which are like very low, like for example very low SpO2 will blink red, so that the nurse can go and look and attend to that specific patient and not running around attending to the others. So this way they were helping to decrease the workload of the doctors and patients as well. So these are the different 12 vital parameters which are labeled here, which can be measured by this instrument. And here there are some impact which Dozy has created over time. So you would be surprised that during COVID, which was very difficult for many of the startups, they raised 130 crores. So by this, what I mean to say is, like, even if you're working on one specific aspect, if you know how you can pivot and then respond to a situation, it will be useful for your own growth, for the growth of your startup. So they just quickly added like couple of other parameters, and they shifted from like sleep monitoring system to the whole vital monitoring system and the contactless system. So we should be little agile in thinking and adapting to the circumstances, is what I wanted to talk about with this example. So Vishu, maybe we can close here and then talk to them individually and ask them what they want, or where they would like us to help?
Yep. So those who joined late, maybe quickly introduce themselves so that we know, and then.
I think only,
Even PM Akwan has joined.
yeah.
Akwan, if you could just introduce about your startup. I don't think he's connected to the audio yet.
Okay, he joined without audio system, but okay, great. So if you want to speak, you can just sign out and sign in. But if you are listening, this is perfectly fine. So now this is open for discussion. So
Yeah. Hi, sir. This is Aniket from CFHE, IIT Hyderabad. I have also met Dr. In fact, I don't remember her. Yeah, Dr. Hema. Sorry. Yeah. So, Dr. Hema, I think you came during the Innovation Day at ITH on 7th January, and we have met there also. So we are, as I also mentioned, that we are working in the area of detecting non-convulsive status epilepticus in critically ill patients, especially in ICU conditions. So I can see there are a lot of startups who are or who have developed products in detecting seizures and all, right? And many of them are also supported by BIRAC itself, but the solution hasn't came out yet in the market. I don't know whether in terms of technology barrier or maybe in terms of deliverables also, right? So there is a segment that is a general tonic-clonic seizure or something that is a normal thing that can be detected using any technology, right? So there are some sensors like accelerometer and other sensors, which is a kind of wearable band kind of thing, right? So so this is a complete different segment to detect seizure, normal seizure. But the second segment where we are working is non-convulsive status epilepticus, which is silent in nature, and the current management is being done on the basis of suspicion. So what happens is when doctor goes through their daily routine of checking patients in ICU conditions at every 2 hours, they used to interact with these patients, right? And if patients are not responding to their commands, they try to go through their history and try to check what the condition is all about, right? But mostly in when the patient's Glasgow Coma scale is less than 10, right? So they are considered most severe in the condition. And those patients are more prone to throw non-convulsive status epilepticus, which is the dangerous form of the seizure, which can lead you to permanent neural damage, comatose conditions, or maybe death also, right? So the incidence of this particular problem is not well recognized because still the facility and the testing mechanism is not yet developed yet. And still suspicion-based mechanism is there in the system. So we need to capture this particular market. I know this is a very niche area to be work on, but I just want to know your thoughts, like how can we differentiate it as compared to the other devices who are just detecting seizures?
so maybe Aniket, I will go first.
Yeah, sure.
It's true that several companies were supported. They are still not in the market. So if you look at the BAZ last 3-4 calls, this is an idea to POC. Though basically they will be at a TRL 2-3 when they are coming, and when they're completing, they're at a TRL 4-5 kind of thing.
Right, sir.
And also I just posted one company supported by IKP in the deep fund, and of course they also won a BAZ 2 years back, BrainSight. So now they have a solution. They work with an FDA for a digital brain and Dassault Systems. They are building these things. So sometimes when they are with a B2B kind of thing, directly with the hospital, they won't be in the social media so much like a B2C kind of thing. Having said that, these niche area things, multiple companies can coexist. You need to look for a little more, in detail about competition. Not just so whenever somebody approaches us, IKP team, BAZ team especially through IKP Technology Transfer Office, we help them with a quick pre-research, letting them know what are the IPs filed, what are the technologies existing, just for their information. Sometimes they may not be in the market, but if they have filed and granted IP, you will come to know. So now the time is very short, so 5 days. But in case if you think that you would like to know these things, I would request you to. I will request Apurva to post the email ID. You can send a short note and few details. We will help you with the pre-art search, so that
Sure,
you will
sure, sir.
understand little more about the competition, because that is the most important thing: competition and the customer.
Right, sir. Right, sir.
Okay, over to Hema if you want to add.
No, Vishu, you have covered. So just wanted to tell everyone over here. So with from the IKP Prime, like the tech transfer office, we help the innovators in their legal, their IP, and the technology commercialization activities or the services. So if you want to do any kind of like say IP landscape or a prior art search, or you need to file a patent or do any other forms of IP, we would be happy to help you. So you just, Aniket, you can just write an email to the mail ID where you have where Apurva has posted, and
Sure,
then
sure.
we can get connected.
Yeah, sure, ma'am.
Any other questions?
Hello, everyone. I hope I'm audible.
Little bit louder, please.
Is it better now?
Yes.
Hi, this is Sampra from Symbionic Chennai. I just had this question. We are developing prosthetic bionic hands for upper limb amputees. We already have a POC. We have our first 10 users on board for the beta testing. And we have also done one test run with our very first user. So I just wanted to know, like, I've been reading about the BIG grant, and I looked at your slide also. So we are past the POC stage and we are at the MVP stage. So is it like, are we eligible for the grant? Like, is it a good idea for us to apply, or is it just for POC level ideas?
Okay, maybe Hema, I can just comment here. So when you are saying MVP and the testing, and of course I know about Symbionic, and they have received a very good feedback, and they were just on the borderline, and somehow unfortunately they didn't make it. But I know your team and Rishi and all, you guys are doing an excellent job.
Thank you.
So when you are applying for BIG, it's very important, in the beginning I told like what you will do with the 50 lakhs and what are the 1 or 2 things you will achieve that need to come out very clearly.
Okay.
So if there is a validation, if there is a comparison with an existing product, so you can present your case. So it's not just about if you have made a sale, 1 or 2 sale, it doesn't mean that there's a final product. So for example, if you have to make a design for manufacturing and looking for materials, so you might have done some of these processes in place. But if you ask me, if you are looking at establishing a full manufacturing facility, looking from material evaluation, clinical evaluation with hospitals, and then taking this feedback and making it better. So I think if you are falling at a TRL 3-4 kind of thing, for those points certainly you can apply for BAZ.
Sure, because we are not market ready yet. We have the minimum viable one and we are still iterating. We still have a lot of way to go before we can actually commercialize it. So
yes, and many a times, when the reviewers see the website, it's good that, many of you maintain websites very nicely, but they say, Visu, ye pura product tayar hai, like, they are already going to hospitals. I think, it's very important to bring out what are those 2 or 3 things you will make with the 50 lakh rupees and what is not done. So on the website or social media, we usually present all the success stories, right? So,
true.
Or maybe we will slightly, pitch it slightly higher, hyperbolic pitches, which is fine perfectly. But when those reviewers see those things, they will think that ye to ho gaya sab kuch, all these things. But trust me, I had seen many of these things. They feel everything is done, but from the regulatory point of view, from from a manufacturing process point of view, many things are not yet done. So you can look at those points. So let's say whatever MVP you have, weighs, I'm just taking an example, don't get offended if I don't know the exact value. Let's say it weighs 2.5 kilos and it has 5 or 6 motors. So you're coming with an innovation to make it, let's say 400 grams, changing a material completely from XYZ, and you until now you focus so much on cost and you're reducing only the cost, but by actually serving 2 lakh rupees thing instead of 25,000, you can actually give for a 1 lakh rupees with a much better material and a lightweight material. So you can do these things, internally, since you have already a basic MOP and, other process in place, you can come with, this is what we want to do. It can be a very simple thing, like, Hema presented an example where they are just extracting, banana fibers and making them, hard enough to be used in a brush. That's all. But they have evaluated microbiology, like, whether there will be any bacteria present, how it will work. So they have presented enough things that help them to take them to the market. So for your project, I'm sure you will be, better judge than me. I know only, what Rishi presented or what I'm reading in LinkedIn or maybe on your website, but you people know much better than what I'm hearing. So you can think about presenting, and you guys are doing very nice. So wish you all the best. And
Thank
if
you.
not for BIZ, I think, there are a few assistive challenges where you should focus on.
Okay.
So I will actually request, if you are Varun sending an email to Hema, I will request you to, ask for a connection with assistive challenge. So there is a team come IISc Translead. They won Atal Innovation Mission assistive challenge for 1 crore. It's called ANIC.
Okay.
So that will be actually a
And,
much more,
yeah.
So those kind of things, the winners and, people who got will be able to help you much more than me actually, because they have been through the process and they have received those support. So just, for everyone benefit, I will share the Translead team. So in this, actually, it's quite simple. Means, many people might think, "Isme kya hai?" But this is a chair that helps in reducing the impact when elder people or anybody impacted with the knees, legs, hips are having problem. So it helps you sit down slowly, and when you give a hint that you want to stand up, it will push you. And when you are sitting, there is a zero force. So it's a simple mechanical solution. It's the closest competitor is a 30,000 rupees with the electrically operated one. So they received the ANIC grant actually for assistive, and now they are actually, with support from various things, and happy to share they also won several other funding from IKP to actually start producing the product. So you can always think about, how to present in what particular thing you want to present. It's not about, presenting a complex thing. It can be a simple thing. I'm not saying this is a simple thing, but this is a very useful thing. It's also important purpose, and I'll be happy if these kind of things are there in railway stations and bus stands, not just in IISc and, in some premium places, but everywhere.
Yes, sir, sure.
Yeah. So
Okay. So any other suggestions or feedbacks? Like you said that last time also we got back just by a little bit. So any suggestions that you might have for us, how we can do better this time and present ourselves, like, any details that we might have missed?
So as you mentioned, you have advanced from the early stage, and, you have done, and you have several functionalities established. So you should come out with very clear objectives and milestones. So what you will do with 50 lakh rupees, it can be a simple material change, simple reduction in the weight, maybe an improved. So you please look at the earlier feedback, what you received, and if you can actually start your pitch with those answers. So we came to you 2 times, and, you told these things are not there, these are not good. So we have worked. And then you have also mentioned that there is a huge competition, but we see that, we are serving not just the premier customers, and our aim is to make it. So you bring those points, and those 2-3 points which you can highlight will help you.
Okay, sir. Sure, sir. Thank you.
Any more questions from the audience?
Yeah. Hi, this is Aniket here again.
Bolo, Aniket.
Yeah, so basically, in our product, there is 2 things. One is obviously the software that supports the device and make it intelligent to detect what is abnormal going behind your brain, right? And having said that, so what could be the milestones in terms of, especially in terms of BIRACS milestones, 2 or 3 things that we can really put it?
So milestones, the objectives and the milestones, basically objectives is what you will achieve and milestone is for releasing the funding of the next level. So let's say 50 lakhs is released as 15 lakhs, 15 lakhs, 15 lakhs. For each 15 lakhs, you need to submit, what you have achieved. That should be quantifiable. So let's say in your case, you are saying about, screening for epilepsy. I'm just taking example very superficial. I am not very familiar. So let's say that, you can develop a software based on taking the prescription and the patient condition. You can give a 80% accurate report. So the milestone one, the objective one is to reach the sensitivity specificity 90% plus.
Yeah.
Within 6 months time.
Mm-hmm.
So that will be the once you reach there, that will be your milestone, and you have to show with numbers and data how you reached and how it is showing. What is the data set? What is the training data set? What is the test data set? And in software, so we have a few cases where software, hardware, and pure software teams actually have won. And I posted actually BrainSight, which is a pure software one. There actually opportunity for you to present at the scale at which it can be done and how it can be done with very limited resources.
Yeah, right. Sir.
So I think, you need to bring out those points as value proposition, and for objectives and milestone, you people actually would know what you want to achieve,
right,
and what it needs to go there. So what are those 3 steps for you to, let's say for going and talking to an investor to make a platform of such kind, what all you would need? So whether investor would like to see a real-time, real world case studies, maybe 20 case studies where they use normal, and doctor also will simultaneously use your platform and say that this is as good, better, not good. I don't know, means you have to find out what are those 2-3 steps to for you to go to an investor and convince. I think, once you think from that point of view, your milestones will be very clear what you want to achieve. Objectives are basically, entire work, how you will do, what you will do in more details.
Right, sir. So in terms of team combinations, we have obviously developing these electronics based solutions. We have one person who basically works in the area of data as well as electronics. One is a mechanical guy, and we have doctors with us. One is HOD of NIMS, neurology department, Dr. Zabin is there. And then there is vice chairman of SWIMS Tirupati, Dr. B. Vengamma. She's an Indian Epilepsy Foundation's president. So they all have validated our need statement, and they are with us and helping us in getting data and all. So we have also proposed a study with NIMS, and now the study is being submitted, and will be also be getting data to work on the software part of the solution in the first cycle.
Okay. So I think, when you are making the team slide, it's important. So you have all the right people and, very senior people. Along with the designations, I would request you to stress more on what they bring to the project.
Yeah, sure, sir. Got it. Yeah, thank you, sir.
You are applying this time or for the next time?
So we have drafted our big BiRAC properly. Just need to get through from Dr. Renu and then from Hema ma'am.
Yes, sir will be very busy, and I think you should always give in, little advance time, and like
yes,
next
sir,
4 days is too tight.
Yeah. So if yeah.
Like the prior art search, it will be very difficult for us to do it now. Now it is not possible in next 2 days.
Ma'am, we have done that prior art search. We have done already.
Okay, then it's fine.
Yeah, so just need a final checklist from you and Dr. Renu. If it is fine to apply, then we can apply. If not, then we can apply in the next cycle.
No, just send it, and without any delay. So sir also can check it, parallelly.
Sure.
By Monday, we will try to, reach and see if we can have a call with you or send an email.
Yeah, sure, sir. Done, sir. Thank you, sir.
This is Ravi here.
Sir, please.
From Heart Health. Yeah. So we have already developed and done in clinical validation of the cardiac MRI model. Now we are neat, and the last time we applied to IKP, they said that the market was very niche because that is used for diagnosis and prognosis in a very small number of patients, and plus India doesn't have enough cardiac MRI. This time, the other part that we want to apply for is for cardiovascular CAD screening for coronary artery disease screening with cardiac CT. This is now part of the guidelines in the US since September 2022, and suddenly the market for cardiac CT angiography is increasing. So the question is, I think the time is too less for 5 days to apply in this round. When is the next round?
So it will open in July,
so-
sir. July 1st.
So that will be too late. I think that will be quite.
So since you have already applied and most of the things are in place, if you want to apply in, if I'm in your team or, I have to do something, what I will do is, so wherever, so when you are saying that, IKP said it's not IKP said, like this is a national level process, it goes
Right.
through an online review of BIRAC experts.
Right.
Start taking their reviews and wherever they said about the market and bringing with the numbers, not just from the US perspective, but even from the Indian perspective. If you talk
Yes.
with, a few people, you can present with the numbers. So let's say that, presently you are saying about, coronary artery and related, right? So X number of
Right.
patients are there in tier 1, tier 2 cities, and this is the load for
Right.
them. And this is the cost. I don't know, means like, what is the
Yeah, yeah.
present?
See, they are part of my standard pitch. What
Yes.
I will do is that in the next 2-3 days, I'll try to change all those relevant sections and then submit it for cardiac CT this time.
Sure, sir.
Now-
And also I would request, when you are coming to rich sessions next time when Ambu sir is there, to come and bring those things and, have a close look.
Okay. The question is, you mentioned that the feedback will be available from the grant application. Where can I access that?
If you can just, share, you have Apurva's mail ID. She has just posted Team BIZ. If you just send, your proposal, she can actually look and share if it is not already shared.
Okay, the older one.
Yeah, older one.
Okay. What's the email ID?
It's there in the chat box.
Yeah, 1 minute. Let me just pick it up so that, because once the thing closes, it will close. Yeah,
No, I would request Arvind to send a mail that, they can be reached at so and so, and
okay, I'll do that. See, Vikraman Benu was the person at that time, if you remember.
yes.
So I had applied
No
the-
worries, sir. Like,
Okay.
sometimes they don't get exact point, and sometimes we don't present the numbers in our favor. Being scientists, and we are very focused on things, and we don't, sometimes understate some things, or we don't state very clearly. So it's possible from both sides there will be not so correct things. So
Right.
our job is to make sure that, we present in a better way and they understand it.
Yes, absolutely. Thank you very much. Yeah.
Thank you, sir.
Sure.
So we are almost there, and if there are any last question, we can take, because we have another session in few minutes.
Sure, sure, Visugaru. Or else, if the participants have any more questions, right, like I can post it out to you personally. I'll also drop my email ID and WhatsApp number in case if anyone would like to get in touch with IKP team. You can directly text me and I can connect you with you. This is my WhatsApp number. You can feel free to reach out to me. Thank you, Visu sir, and thank you, Hema Garu, for your time and taking the applicants, taking the startups through the different schemes that are available under the government, as well as guiding the startups on applying for BIG as well. Yeah, thanks a lot from our end.
Thank you, Arvind, and thank you, everyone.
Yeah, thank you, Arvind.
Thank you, sir.
To everyone, and all the best.